So consider yourself as a pathologist and you're carrying out an investigation. You are doing an autopsy. You have performed an autopsy on a person who have had bite marks, and you're basically going to personally identify the suspect in that case. So the bite marks are the mainstay of the investigation over here if you're carrying out such an investigation, and to have the knowledge of the forensic odontology, which is basically a branch of forensic medicine that deals with the dentition or the forensic dentistry, which is kept in use when you're carrying out the personal identification for the person and you're including or excluding a person from the suspect list. So it's very important and it's very crucial to have the basic knowledge. How are you going to move on in your investigation whenever you have bite marks at our hand? So there is a lot of trace evidence in the bite marks. The saliva or the blood, if it is found in the bite marks, the swabs are taken and is sent to the histopathologist for the further detailing of the bite marks. And through these bite marks, the identification of the suspect is made in a correct and in a more accurate manner. So it's very important and it's very critical to carry out it in a proper and in a more scientific method. So the matching of the bite mark with the suspect's dentition is very important, as we've already emphasized upon. Even if the dentition or the bite mark is not giving a complete information about the dentition of the person, there can be an information regarding the bridges that were used, regarding the forensic, regarding the dentistry record of the suspect. We have to match that record with the record of the bite mark. So the preservation of the bite mark is done in such a case, and sometimes even the area that involves the bite mark is incised and is re-examined after some time to get the further details from that area. And the complete details from that area. The correspondence between the teeth and the bite marks basically gives you an idea that the suspect list is shortlisted and you have a lot lesser number of suspects in your list. The tooth impression and the identification of the dead is also done in a correct manner. In a way, whenever we have the tooth impression of the person or the suspects, even it can be done on the food items, the casts are made in a particular case, and the identification of the dead is sometimes made by the complete examination of the teeth. So this is the whole mainstay over here. We are basically personally identifying the suspects in a lot of cases, and in a lot of cases sometimes you have to examine the teeth of the person who is dead and you have to personally identify the person in some cases. So matching the bite marks with the suspect's dentition is very crucial over here. We have to look for the striking dental features. For example, if there are the striking dental features can be the crowns or the bridges used, the amalgams used for the tooth fillings. And if you have some deformity in your teeth, for example, there can be a calabri teeth in which you have an extra cusp for the molars. So this basically calabri teeth or any malformation can be recorded down from the dental record of the suspect. If there is no distinctive feature and there is no correspondence in a particular case, the examination of the teeth of the suspect is carried out in a lot of detail over here. The legal investigations are done in this particular case, and if it is a case of child abuse and you're suspecting that this was a particular case of sexual assault or it was a case of a child abuse, the consent of the parents is again very important over here whenever you're going to carry the investigation in a particular direction. So the examination of the dentition of the suspect and as well as the dentition of the child is very important whenever you're carrying out the investigation. The correspondence between the teeth and the bite marks is made. The presence of full or partial dentition, denture is made. So it can be through the radiographs, and one has to keep a very important point in your mind when you are carrying out an investigation in a child abuse case, that sometimes these adolescent kids they self-inflict injuries just to gain the attention of the people. So this child psychology's aspect has to be taken in mind whenever you're considering these bite marks. The medico-legal aspects also includes the self-inflicted harm. So the number of teeth in the upper and the lower jaw is counted whenever you're charting or making out the comparison between the dentition of the suspect and the bite mark. The charting of the missing teeth, especially the incisors and the canines, is done, and the dental record of the person is also taken out to have a better comparison, and the estimate of the bite overhang basically. So recording the broken teeth or the teeth with significant abnormalities is done in quite detail. If there are any records of any irregularity in the cutting edge profile, the evaluation of the size and the prominence of any teeth is also made in general. There can be recording of any abnormality, as we were already mentioning, the calibri teeth in twisting orientation, it's another malformation. The gaps and the irregular spacing is noted down, and these are basically the vital factors and the vital malformations that is going to give you an idea for the personal identification of the suspect. So a lot of materials are used for making out these scars. It can be the wax or other bite registrations. The usage of modeling clay, plasticine, and beeswax. These are used to get the cast out of the suspects, and they are then fixed with the formalin. The animal bites are excluded at this age. If it is a more U-shaped bite, it is going to tell you the fact that it was an animal bite rather than a human bite. The abnormalities in teeth may be present in the bite marks. The matching marks are photographed with the teeth, and if there are tracing of any cast, it's also noted down at this point. The inking cutting edges of the front teeth also gives you an idea about the personal identification of the suspect. The tooth impression is made for the better evidence than the absent marks. If there is a gap in the injury, if there is a gap in the bite mark on a hole, the tooth missing or the occlusal edge is not basically giving you a mark at this level. There can be skin distortion during the biting phenomena. The canines, they basically provide particular help when prominent and pointed. The premolars and molars are rarely used for the identification, and if there is a severe kind of a calibri malformation, it is going to basically be documented even in the previous dental records of the suspect as well. The identification of the dead from the dentition is again a very important aspect of the forensic odontology. It's basically going to give you a DNA analysis. The dental investigation basically includes the identification of the mutilated and the burnt bodies in the mass disasters. Two prime avenues of investigations are also should be kept in mind. It can be a general or reconstructive identity, just basically classification upon the facts of the age, sex, and race of the person, and sometimes it can be for the comparative methods to confirm and exclude the personal identity of the individual against the ante-mortem dental records. And it can only be done if you have those dental records at your hand. So when you're carrying out this personal identification from the dentition, the techniques like radiology or tooth sections may be quite beyond the pathologist capabilities, and sometimes you have to have the expertise of the forensic odontologist to be at your hand. So in this section, basically, we dealt with how the bite marks are important for just carrying out an investigation of the suspect, and you're basically shortlisting your list of the suspects, and if you're going to carry out the personal identification of the person himself from the dentition records. It's again very important. So that is the end to this section. Thank you for watching sqadia.com.